In preparation for ICCD 2026, we asked global health and science leaders one question. What is your message to policymakers for ICCD 2026?
Well, to know that, yes, children are a vulnerable group. They are often marginalized, particularly when it comes to their health issues. And we need to understand that, first of all, yes, they do get cancer. So many people come to me and say, no, is it possible? Children don't have cancer. It's a big people's disease. But yes, they do get cancer. And we need to do better by them. We can do better by them by really pushing and putting in place those policies, those fundings, making the work environment more conducive for our healthcare workers so that they're not flying abroad and going to look for work abroad. The primary healthcare structure is so important. The health system now is the key to really becoming a good, universally accepted health system is by having a sound primary healthcare system. So if at the primary healthcare level, we are able to solidify prevention, treatments, and everything for our people, then we are home and dry. It's not happened yet, but it's in the process of happening, and we have hope that this we will see that day. So to our policymakers, to everybody out there, support the children. It's a day that we recognize them, we champion them, we celebrate the survivors. So there's so many ways you can support. If you're not a policymaker, you can join a civil society. You can donate your time, your efforts, your money to a civil society that is involved in working in the childhood cancer space.
Yes. So the message is straight and simple.
Yes.
Strengthening pediatric oncology nursing is one of the most powerful, cost-effective strategies to improve survival for children with cancer worldwide. Investing in training, supportive policies, safe staffing, because the numbers are a problem, and nursing leadership, it is not optional. It is central to achieving equitable, high-quality childhood cancer care. Nurses are ready to lead. Decision makers must ensure that they are supported and valued and heard. It is only then that we'll be able to get very good contributions on the health system that can turn things around, especially in Africa, where resources are limited.
So the premise on which I would start this conversation is this, that the future of mankind are children. So if we cannot save and support the children, we do not have a future. So what I told us a little while back, that our focus should be on saving the life of every children. I know that the nature doesn't allow us to save every life, but that should not stop us from trying to do it. And in an attempt to do it, we have to make sure that the child grows up as a normal, beautiful adult. Then only as an individual and as a society, we will benefit from all the approaches. So the policymakers will have to understand the requirements of a pediatric transplantation. It's not just about giving a drug and giving the cells and getting rid of the leukemia at the end of it. It is to, at the end of the day, to have a beautiful growing child who grows up to be a wonderful productive adult who is of wonderful benefit to the society. So if policymakers understand that investing in these things is going to end up in that sort of goal, then I'm sure they would think about investing here. It is not just about give money and do a transplant and go to the next one. So it's like planting each flower and watch them bloom. So you have to give the fertilizer, give the water, have the sun, have the rain, everything in a way so that 100 flowers can bloom in every part of the world.
I think we are still on the invest in health system solutions. Biology matters, but survival gaps are often driven by access, delays, and continuity of care. The priority is to treat the system as part of the cure. But on the other hand, on the way of childhood cancer prevention, by generating solid scientific evidence for guiding health public policies.
So for the policymakers, generally, I think they are working hand in hand, probably. So one may just put the regulation in, one may interpret that one. So they work hand in hand, actually. So as I said, childhood cancer is just coming into picture nowadays because there is a proper control of life infectious diseases because of multiple like vaccinations, probably multiple budgeting like malaria, tuberculosis, and other diseases are now decreasing in terms of mortality. And now it is time for attention for non-communicable diseases, specifically cancer. And particularly when it comes to childhood cancer, this is one of the curable diseases actually, if you catch it earlier. So everyone should understand that childhood cancer, specifically if you catch it earlier, is curable. So that everyone should invest on children specifically. So as I said, WHO estimates multiples of children to get diagnosed, but the policy yet has been not giving any attention because it has been like attention was given for communicable disease rather. So childhood cancer is curable. Collaboration is the only way forward. Everyone should work collaboratively. Capacity building is always the key for cure of childhood cancer. And as I said repeatedly, if you catch it specifically at the early period, childhood cancer is always curable. So that specifically the policy should focus on early identification of childhood cancer. So this will be my message actually for the international collaborators as well. Funding may be one of the most important thing in terms of capacity building, having researches as well, and implementing multiple infrastructures. So collaboration at the national level, regional level, and the global level is very important. And Africa specifically should come into same village so that the communication will be easy through sharing of information and data specifically. So we have to create one Africa, the so-called one Africa, because it has a capacity and multiple, as I said, the genetics makeup is too complex, and studying that one may be one of the features of cancer care. At this time we are giving only, in Africa specifically, we are giving only traditional chemotherapy, which is toxic to the body. But when you advance treatment, it may be only targeted therapy. So the side effect, treatment-related mortality and morbidity may be reduced through that. But these things will be achieved only with collaboration at any level. So we need to have one Africa, United Africa, with the same intent for cure of cancer through application of genetics. That's my message.
Okay, so that's very difficult question because all of the action are priority in my point of
Yes.
scientific, clinical, or policy related. I think the clinical approach is now, I think it's for some types of, for the majority of the subtypes of childhood leukemia and cancer has succeeded, is very successful. I think the scientific is always associated with clinic. In my point of view, I always, when we work in translation now, this type of translation now, epidemiology, the scientific and clinical come together. So the policy related that I think should be more in the priority, because as childhood cancer is treatable and has to be treated in very early in a clinical point of view. I think the investment should be, in my point of view now, in this policy related. And this will improve for sure the outcome, because it is still some in our countries, in low and middle low country, is still some problems to accept that childhood cancer is treatable and is curable.
For the policymaker worldwide, childhood cancer really is a curable disease when system work, and really we need you to invest in children futures.
Policymakers should consider that probably cancer is not the main disease, but is the main cause of death, is the main cause of death as a disease in pediatric population. And pediatric population in some countries is almost half of the whole population. In Mexico is 40%. Probably in industrialized countries is less, but it's a huge proportion of the population. So if we consider that one of the main groups of population, that cancer is the main cause of death in the main group of population, you should direct your efforts to treat and and you should invest in the cure of cancer.
What's your message to them?
Thank you. It's a big question. It's a big question with a global view. I would say in each setting, through the international works, I love to know and to talk to our international friends who are working for pediatric cancer around the world, because the settings are sometimes quite different. That the goal is the same, but the context is different, so that the ways of doing things will be different. So that I would suggest policymakers to listen to the needs of them, because the needs will be quite different every time. And so listen is the first thing. And the second thing is to currently there's no more, COVID is no longer a barrier, so that we should promote a more international exchange or exchange of knowledge, or international meetings, international collaborations. If the policymakers can help, this will help a lot and make a lot of difference. Although that may require some different strategies in each setting, but through for example, twinning programs, or point-to-point twinning programs, or sometimes country-to-country, or sometimes a group of hospitals to another group of hospitals, or a group of doctors to another group of doctors. This kind of collaboration means a lot, that we can learn more through the interactions and through the scientific discussions, and also even clinical discussions. Currently, we are trying to work with other Asian countries, like, for example, we have international students who are also physicians in their country. So we are working with our colleagues in Vietnam to discuss about for example, brain tumor therapy, how we would do this in our setting. But we also learn a lot from them that in their setting, sometimes there are some limitation in their setting, and we have some of our limitation in our setting, but how do we deal with it? And we think how to achieve the same goal is to try to cure the disease and to keep the child healthy with less late effects whenever possible. So I would say listening and international collaborations are the two keys I'd like to suggest the policymakers to help to support pediatric oncology in the world.
Across continents and disciplines, the message is consistent. Policy must be guided by science. Funding for research must increase, not decline. Precision medicine must be made equitable and accessible. Nurses and frontline health workers must be trained, supported, and empowered. And communities must be heard, because listening is the foundation of effective policy. ICCD 2026 may have concluded, but implementation begins now.